navicular drop, and navicular drift. With navicular drop, we're going to measure vertical excursion of the midfoot using a business card. And with navicular drift, we're going to measure medial lateral displacement, and you can just use a piece of paper. This is the setup. First, you need to determine sub-talar or talar-navicular neutral. The image on the left is in a pronated position. You've encouraged the patient to internally rotate their leg and to collapse their arch with a little assist from your right hand. And the image on the right is in neutral. You can palpate the medial or lateral sides of the talus, or you can use the anterior method, which is shown here, where the tibia and the second ray all align. So now that we have the patient set up in a seated position, make a mark on the navicular and then the business card. Make sure the business card is roughly perpendicular to the floor, which is not exactly shown here. You're going to have the patient stand, and you're going to measure the amount of displacement by making a mark on the business card and measuring with a ruler the amount of displacement. There's some conflicting research, but in general, you're looking for about 6 millimeters of displacement from a seated to a standing position from neutral. For squatting, 10 millimeters or so would be expected. We're going to then compare this to navicular drift. With navicular drift, it's a very similar setup. The patient's seated, foot's in neutral. Draw a dot, make sure the pen is perpendicular to the paper. And you can see the line here that represents the tibia and the foot are relatively vertical. The camera angle makes it look pronated, but you can see here that it's extremely pronated once the patient stands or squats. You're going to draw another dot, again making sure the pen is perpendicular to the paper, and then you're going to measure the distance. This is roughly 20 millimeters. This is a pretty big excursion, a pretty big navicular drift. You compare this to the navicular drop, which tells you about the vertical plane, and you get a sense of the planar dominance of this foot. More of a vertical drop, you might see that arch support might come in handy. If there's a big transverse plane component as shown in the navicular drift, that may not be as effective. You may need to think more about other factors.